Great. Let's get started. First up, we have BioBot, and Nusha will be speaking from BioBot.
Hi, thank you, Rebecca. Hi, everybody. Thank you for joining today. I'm going to share my screen and get started. So my name is Nusha Gailey, and I am one of the co-founders at BioBot. I'm president at the company. And BioBot Analytics is a wastewater epidemiology startup. It was founded during my time at MIT. It's where I met my co-founder, Dr. Mariana Matus, who did her PhD on the subject of wastewater epidemiology, while I was a research fellow in the Department of Urban Studies and Planning. And our mission at BioBot is to make public health more proactive and equitable by leveraging sewage. So what is wastewater epidemiology? Well, what do we actually do? We measure the concentration of viruses, bacteria, and small molecules, so chemicals, that are excreted in urine and stool and collected in our sewage system, in wastewater. We really see wastewater, we see sewage as being an aggregated urine and stool sample. So in the same way that our doctors can diagnose individual health, our objective is to diagnose group health, whether it's the scale of a building, a campus, or a city. We can really leverage wastewater to look at all sorts of human health indicators, ranging from infectious disease outbreaks to diet, nutrition, as well as looking at indicators of consumption of different types of drugs and pharmaceuticals. In 2018, we launched our first product, which was looking at what was the biggest public health crisis up until about 6 months ago, the opioid epidemic. So we were measuring opioids and other illicit drugs, as well as other drugs of concern, such as cannabis, cocaine, methamphetamines, to really be able to shift looking at overdoses as a metric to understand how we're doing with the drug epidemic in the US, to looking at what is being consumed in real time and excreted in urine. In February, we shifted our focus when we pivoted to COVID-19, when it became clear that patients were excreting the SARS-CoV-2 virus in stool. That's when we knew that we could leverage our technology to really detect the virus and therefore infected patients in a community. We partnered with the MIT Alm Lab, so we partnered with a lab at MIT as well as researchers at Harvard and Brigham and Women's Hospital in order to do this research. And we're actually the first team in the United States to successfully detect the SARS-CoV-2 virus in sewage. So this is how it works. Our clients receive a sewage sampling kit from us. So they're collecting a 24-hour composite sample of wastewater. It's very important that the sample is collected over 24 hours, as we are then confident that everybody has contributed to the sample. Everyone uses the toilet at least once during the course of a day. So they're collecting the sample, whether it's taken from the clean out at the building level, from a manhole, from a lift station, or a wastewater treatment facility. And then they distribute that sample into this kit and ship it back to our labs, which are in Cambridge, Massachusetts, for next day delivery. We are then doing the lab analysis in-house all the way through to the qPCR analysis in order to be able to get the concentration of that SARS-CoV-2 virus in a sample of wastewater. We're then taking that concentration and we're leveraging other data sets in order to model and visualize information that is helpful for making decisions like, and understanding questions like, what is the infection rate in my given community? And how are we doing with respect to last week? Or has the infection rate gone up or is it going down? We're also able to contextualize that sample with the thousands of other samples that we've been looking at to date. So in March of 2020, we launched in partnership with MIT, Harvard, and the researchers at Brigham and Women's that we were working with. We launched a pro bono campaign in order to work with treatment facilities across the US. Our objective was to work with 100 facilities. Within about a week, we hit that 100 facility cap, and we were getting inundated with inbound from communities, several hundreds of communities across the country. Ultimately, we worked with 400 treatment facilities through the end of May. These facilities were in 42 states, representing about 13% of the US population, as well as a couple facilities in Canada that we were working with. And you can see in the map here that really we had very, very broad distribution. So with only 400 samples, we were able to generate COVID-19 case estimates for about 13% of the US population. And what we found was that wastewater data is predictive of new cases. This has been published and written about in our latest scientific paper, which is available via preprint, and you can find it on our website. But wastewater data is predictive of new cases by about a week. And you can see here, this is a plot, a trend line from one of our clients that we're working with. This is a municipal client where we've been collecting weekly samples over the course of May. And you can see the blue dot is the relative concentration of that wastewater sample. And you can see the 4 blue dots. And in behind, in the lighter blue, you can see the trend line of the reported new clinical cases. And so you can see that the new clinical cases really do mirror, in terms of the trend line, what we're seeing in wastewater. And we think a big part of this is likely because we found that individuals are excreting the virus in stool within days of getting infected, whereas clinical symptoms take a week or more to present themselves. So we can actually detect new infected patients via wastewater right away. Since ending that pro bono campaign, we've launched now, as of June 1st, wastewater epidemiology as a service. And we've been receiving a lot of inbound from not only municipal clients across the US, but also university and work campuses, places of work, as they're all working to put together their back to work plans. And the number one question we get from all of them is that they don't know when to test all the individuals. And so this can really help.
So my name is Ronnie Kubat. I'm a co-founder and CTO of a company called Tulip, which is an MIT startup. I spent about a third of my life at MIT through the Department of Computer Science and Mechanical Engineering before starting Tulip. For those of you that sort of don't know what Tulip is, we're a platform for industrial operations. We've started focusing in the manufacturing sector, and what we make is a tool for manufacturing engineers to create their own kinds of applications for the frontline worker, for the operators on the factory floor, and doing this in a cloud-based manner. And so today, you know, our customers are mostly discrete manufacturers in everything from like automotive or aerospace to pharmaceuticals and apparel. But today I want to talk about a couple of sort of initiatives that we had with regards to coming back to work and what this means around this kind of tool. So, you know, manufacturing is one of these special cases where you really cannot effectively work from home because you have to actually make a physical thing. And so, you know, when you may be able to take some fraction of your employees and they can continue to work from home, but the operators are the ones actually doing the physical things need to come in. But so how do you do effectively more with less in this kind of environment, while, you know, critically maintaining the safety of the employees? And the other thing that has been, I think, transformational here is that there's been effectively no time to make this transition. You know, shutdown happened effectively instantly, and coming back is happening on a very fast scale compared to the traditional approaches to the tool sets that are being used by manufacturers. So to give a couple of examples of what this has meant for us and for our customers, one example of what we did is to create a collection of applications focused on facility safety that can be used by our manufacturing customers for monitoring and understanding sort of where their employees are, like physically within the buildings. This is from self-reports and things like that, in order to both maintain a density level as mandated by state authorities, as well as understanding the sort of from a contact tracing perspective, like who was in when in the event that someone comes in. So this is a collection of both mobile applications used by any employee within the facility, an application that runs at the entrances to the facilities to help where people sort of check in and out of, and an application for facilities management to track this information over time. So this is an example of a set of applications that we built over the course of a couple of weeks, and now providing to our customers who have started to use this to track their employees as they're coming in. A second example is just kind of a little bit different from the perspective of coming back to work, but is representative of something that is something about building the tools in a cross sort of work from home as well as in facility. This is an example of some work that we collaborated with a group called Masks On, which is making durable personal protective equipment for healthcare workers. You see here in the an image on the left, this is a snorkel face mask that has been modified with an adapter that allows it to connect to standard hospital HEPA filters. And so these masks can be used in place of wrappers and the like. So in this group, they now shipped about 20,000 of these. They had no manufacturing system in order to handle the distributed manufacturing and distribution of this product. And so this is another example where we had a team that was completely working from home, building these applications that were then deployed at a contract manufacturer, which was making use of this for purposes of tracking and the like. So kind of like the commonalities here is like, how do you take a job, manufacturing engineering, which is fundamentally something that's very tied to the physical world, to the facility in which things happen, and provide them with tools that they can work remotely, can have visibility as to what's happening on the shop floor, while still enabling operators to continue with their work. So there's unfortunately very, very quick time here, so there's much more I could talk about. I'm happy to chat more with folks, and feel free to contact me if you are a company that is making things and is coming back online. Definitely would love to chat some more.
About Humanize, we were born at the MIT Media Lab, and our vision is to make work better and more productive. And we do that by analyzing existing corporate data that lets companies measure and improve their organizational health. So why do we do this? Because organizational health is a big problem. Between employee turnover and lost productivity, companies lose trillions of dollars each year from org health. So the question is, well, why is that? Why don't companies address the problems? And it's because it's really hard to pinpoint exactly where and exactly how big these problems are in a data-driven way. So what Humanize has done is build an AI platform which helps employers take actions to target employee health, employee wellness, and therefore improve financial performance. How do we do this? As I mentioned, we analyze existing corporate data. Specifically, we take extracts from your communication systems, things like Office 365, the Google Suite, Slack, Skype, and so forth. And we look at the digital exhaust of how people are communicating, who they're communicating with, what time, and so forth. And it turns out just by looking at that data, you can learn an awful lot. Things like, how much time are people spending in meetings? And are those meetings productive? Or are people multitasking? We can see that while they're in the meeting, they're also sending Slack, and they're also reading emails and so forth. And in particular, now that everybody's working from home, the question has been, how has that changed? How is this impacting the way people communicate, the way they collaborate, and what are the short, medium, and long-term impacts of that? As Professor Raskar described earlier, it's really important to start with a focus on data privacy. So in our solution, we never receive any PII data. We never receive any content. We don't care about the names. We're not about what they're talking about. It's really just about how, within the organization, how is collaboration taking place? And are there teams? Are there groups? Are there geographies? Are there floors within the building where things are not as healthy as they could be? So since we don't take PII or content data, that means that we can be GDPR and CCPA compliant. And at the end of the day, what we're trying to do is to convert this data into, again, very specific metrics, things that give the leadership team, the management, real insight as to employee engagement, as to team productivity, and as to organizational adaptability. Because if you can look at these and double click on where there's areas of weakness, then you can take targeted action. So a recent example, we've been working with a large multinational bank that selected Humanize to help them plan out a new corporate headquarters. It was a $3 billion project, and they were going to be moving thousands of employees, and they wanted to know who should sit where, who needs to be near which colleagues, how can this space support them. But then COVID hit right in the middle of this project, and now we're actually using the same technology to think about which groups do you bring back to work and when, because we can see where did collaboration get disrupted when things moved to work from home, and which are the teams that have adapted well, and which are the ones that really haven't done quite so well, and therefore it makes sense to prioritize bringing them back into the office sooner. And specifically, who do they need to work with? So if you're going to bring, say, inside sales back, do you need to have the BDRs or the business development folks with them, just as an example. So quick snapshot about us. And for us, if you're a large enterprise that's interested in how this could help your company, or a reseller that would like to bring this to large enterprises, we would love to connect with you. So thank you so much for your time this afternoon.